Sensory overload at school. Have you ever experienced a sudden rise in body temperature when you walk into a crowded room, causing your heart to beat faster? But now imagine experiencing more than just a minor discomfort or distraction that can be easily adjusted. Drinking something cold causes your teeth to buzz with electric nerve pain, or a shirt tag scratching your back feels like a tiger attack. Sensory overload happens when the brain receives more sensory input than it can process. For children on the autism spectrum, this sensory overload often stems from perceptual or biological experiences, but can also be triggered by changes to their routine or learning environment. Let's explore what contributes to sensory issues, how this might manifest in your child, and ways to support children in developing coping strategies or supporting their preferences. What can trigger sensory issues? Triggers can vary widely from child to child, but include loud noises. Things like sirens, shouting, or even the chatter of classmates can create overwhelming auditory input. Bright or flickering lights, fluorescent lights, for example, may be harsh for some learners, causing discomfort or distraction. Crowded spaces, like hallways during transitions or busy lunchrooms, can lead to anxiety or sensory overload. Non-preferred textures. Food sensitivities are common in children with ASD. Some children have strong aversions to specific textures or types of foods. Some children do not like touching things that are wet or sticky. Some children have strong preferences for loose clothing, maybe going without socks, or they might ask to have the mesh liner cut from their swim trunks. Unexpected changes. Sudden schedule changes or new routines can heighten anxiety and sensory sensitivity. This is sometimes called insistence on sameness or inflexibility. Children with an ASD diagnosis may be predisposed to sensitivities. It's baked into the diagnostic criteria, categorized as repetitive and restrictive behavior. It can be part of people's neurobiology. While triggers and sensitivities are idiosyncratic, teachers, caregivers, and support staff looking for patterns or potential triggers are key to helping learners navigate their school environment. When possible, your student may tell you, so be sure to listen. With some children, you will have to look and take time to observe behavior associated with sensory issues. So what should you be looking for? How sensory issues manifest in your child or student. Let's go back to that squeezing feeling around your waist. What would you do to alleviate the aversive or unpleasant feeling? Squirm? Adjust your clothing? Snap at somebody about an unrelated matter? It might look the same with your learner, or it could look like attempting to leave or avoiding certain spaces to get away from certain people or noises. Difficulty focusing or attending. Irritability, restlessness, or discomfort that might take the form of increased physical movement like stereotypy or stimming. Covering their ears or shielding their eyes. Feeling overly excited or wound up. Stress, fear, or anxiety about your surroundings. Avoiding or removing clothing that certain textures, fabrics, cloth tags, or other things that might rub against the skin, like constantly taking off socks or shoes. So if you figured out that your learner is sensitive to a particular event or stimulus, now what? Let's teach proactive and reactive strategies. Supporting learners in developing coping strategies or supporting their preferences. Let's talk about how we can avoid meltdowns proactively and accommodate preferences before sensory overload happens. Here are some strategies. Create a sensory-friendly space. Designate a quiet area in the classroom where learners can go to decompress if they feel overwhelmed. This space should have calming elements like soft lighting or noise-canceling headphones. Perhaps learners could carry these tools with them. For example, a portable fan, sunglasses, or earbuds with soft music. Establish routines. Consistency is crucial. Having a clear, predictable schedule can reduce anxiety for learners, making it easy for them to manage their sensory sensitivities. In some cases, you might set up intentional practice opportunities for them to practice changes to that schedule. A visual schedule can really help. Teach coping strategies. Equip learners with tools to express their feelings. Techniques like box breathing, tensing and releasing large muscle groups, counting, or even sensory fidgets can provide relief during overwhelming moments. Teach learners to recognize when they feel overwhelmed. This is hard, even for adults. But if your learner can identify when they are feeling overwhelmed, you can ask for a break to leave an overwhelming space, or ask for help to use one of their coping strategies. We call this functional communication training. It's a great way to empower learners to ask for help. Communicate. Encourage open dialogue with learners about their sensory experiences. Understanding their unique triggers and needs can foster a supportive classroom environment. Recognizing and addressing sensory issues in autism can significantly improve the school experience for many learners. By understanding what sensory overload looks like, identifying potential triggers, and implementing effective strategies, we can help create a more inclusive environment where all learners thrive. Here at Learn, we are committed to helping your child, learner, and family find success at each step of their journey. Follow along with our YouTube channel and find helpful tips and content each month. Please leave a comment below and share your thoughts. Leave questions or suggestions for other topics.